So why do things go wrong with our voice? Well, firstly, what do I mean by things going wrong with our voice? It could be just fatigue. Yeah, voice just feeling tired, feeling sluggish, not as easy as normal. It can be that we find we're not able to sing quietly or to sing loudly, that we've lost those sort of extremes of the voice. We may find that our pitch range reduces so that we can't hit the high notes anymore, or that we've sort of got a funny hole in the middle of our voice. It may be husky. It may be just a little bit breathy or a little bit husky or a bit rough around the edges. Another thing that is sometimes an indicator is onset, the start of the sound. Can you make a clean, clear sound at the start, or does it come in with a bump or with a bit of air? Yeah, so those are all symptoms of the fact that your voice may be having problems. So what is your voice? It's in here, your larynx. All right, this is what we're talking about primarily. In the larynx here, we've got the vocal folds, which are they're mainly muscle, actually, sort of membranes that collide together. All right, and as they bind together, they make sound. A little bit like your lips. So two lips, if you hold them together, all right, nothing happens. If you hold them together and then blow air through, you get that noise. That's what's going on in the larynx. All right, the muscles hold them together. We blow air through, we get that farty, buzzy sound. All right, and that buzzy sound goes into our throat and gets shaped and altered, and we have different resonant frequencies that are enhanced. We articulate text, and out comes our song. So those buzzes, those collisions of the vocal folds are happening a lot. They're happening very frequently. So my voice at the moment, as I'm speaking to you, my vocal folds are colliding about 200 times a second. Now, that's a lot of collisions. And if you clap your hands together, all right, you're all muted. Nobody's going to hear you. Yeah, clap your hands together very fast for a few seconds. Then you take your hands apart, and what do you feel? You feel tingling. You might feel a bit hot, right? You've been bashing that epithelium, the surface of the skin. You've been bashing it a lot. And the cells are having to recover. And as they recover, the nerve endings are tingling a bit in your hands. All right, the nerve endings don't tingle in your voice. You don't have nerve endings there, thank goodness. But the other thing that happens is that the cells, as they recover, will be bringing a bit of extra fluid in. So that extra fluid coming in means that things might get a little bit swollen temporarily. So we need to try and avoid that happening. All right, so how can we avoid that swelling? How can we avoid that fatigue? Well, the things that will contribute to it are the amount you use your voice. All right, so that is literally the number of hours a day you are using your voice. And if you are teaching or talking on Zoom a lot, you can add that all up. It can be quite a lot, as well as singing. The level at which you use your voice also contributes. So if you are being loud, if you're having to talk loudly, and sometimes even on Zoom, on camera, people talk louder than they need to. We psychologically see somebody in another room and we shout to them as if they were in another room. That has a significant impact on the fatigue of your voice. How high you use your voice also makes a difference, because as I go higher in my voice, if I'm singing, an octave higher than this, or even 2 octaves higher than this, my vocal folds are colliding twice as frequently, 1 octave up, and twice as frequently as that, 2 octaves up. So that's a lot more collisions. So if you sing high, if you're a soprano, for example, your vocal loading, the amount of effort your voice is having to go through is much increased. The third factor that has a huge influence on that vocal loading is anxiety. And this will go all the way through everything I'm talking about today is levels of anxiety, because it very much contributes to the whole package of voice problems and voice disorders. So what can we do? What can we do to reduce that? The first thing is we can pace our voice use. And obviously rest helps. Yeah. So if you're bashing your voice about and then you stop it, that's rest. That's going to help. We know from research that frequent mini breaks are more useful than single long breaks. This is really, really important to bear in mind. So if you've got, for example, a 1-hour rehearsal or a 1-hour lesson that you're giving, make sure that you build into that lots of mini breaks for your voice. So the mini break might just be 30 seconds or a minute, but it's still time when your vocal folds are not colliding. And lots of those are more use than just taking 10 minutes in the middle. And that is important for you to build into your voice use, and also, if you're a teacher, to build into your students' voice use. And if you're a choral director, make sure that your choir rehearsals take that into account. So mini breaks are very, very useful. What else can we do to help our voices? We can warm up properly. All right, you don't just jump in to heavy duty voice use. You warm up. Now, the same goes for any body use. You don't jump into a significantly demanding sport without doing a bit of warming up first. What is warming up? Warming up is just gentle movements, gentle small things before we go on to bigger things. Yep. So we have to make sure the whole body is involved. So we warm up our whole body. We do some stretches and some moving around, and then we do some breathing. Shh. Make sure that everything is being used well. And then we do some gentle sliding around. Ooh. Now, what am I doing on that on? I'm doing that on a little closure of my lips, ooh, and a little puffing out of my cheeks. What that is doing is giving me a little bit of back pressure in the mouth. And that's a very, very good way of warming up. Another way we can do this is with a straw. Okay, I've got a straw here, an ordinary straw. Ooh, I've got a drawer full of them, actually, different diameters, different materials. This is just a yucky plastic one, but I've got metal ones, I've got silicone ones, I've got all sorts of paper ones. All right, so you can just sing through the straw. Ooh. Okay. Even more effective than that is the straw in water. Okay, that is very, very useful for the voice because the water gives you more resistance, so you've got a little bit more back pressure. The way the bubbles come up regulates, shows you what the air flow is. All right, so if I'm blowing too much air through, then the bubbles that'll literally come up and hit me in the face. So that's very useful biofeedback. And you can just watch the bubbles and you can watch steady stream of bubbles means steady airflow. The other thing that the bubbles do is as each bubble comes through, it sets the air pressure in little vibrations. So what comes back at the vocal folds is a kind of massage of air pressure. Yeah, little bubbling massage of air pressure. So that, again, is very, very useful. Why would massage for the vocal folds be good? Okay. Next thing is tissue recovery and healing. We've got these vocal folds that might be a little bit inflamed. They might be just heading towards getting a bit sort of clunky and not very happy health-wise. How do we reduce inflammation? We know a lot more now about how bodies heal. So 20 years ago, if I sprained my ankle, I would be told to bind it up and keep it still and not do anything that might hurt. Now we know that soft tissue injuries heal much better if we keep things moving. We need to keep that movement because the tissues then heal with less scarring and they heal more quickly. How can we stretch and massage our vocal folds? We can't get in there. We can't do anything. We can't passively stretch our vocal folds. What we can do is singing through a straw. And if we do these exercises through a straw in water, or if you haven't got a straw and water, just do it on or any of those. And we take that through our pitch range. So we start off small. Okay, it's small, and then we get bigger. And you go up and down and up and down. And eventually you can go right the way through your vocal range, slowly sliding up and down and up and down. And if you do that for a minute or two, you will literally reduce the inflammation in your vocal folds. That has been shown in experiments, that is more effective at reducing inflammation than just resting and shutting up. So gentle pitch glides, gentle slides. The other thing that does is it reduces the impact of the vocal folds. Yep, so they don't clap together so hard. Do you remember I said the second factor that contributes to vocal loading is the level of use, how loud you are. And the reason for that is that your vocal folds are banging together harder when you're louder. These gentle exercises will stop them banging together so hard and reduce inflammation. So, some handy tips there. Let's go back to why you might get problems with your voice. So we talked about voice use and overuse. You might have problems with your voice because you get an infection. Okay, you might have an upper respiratory tract infection. And if you get that, then again, things will be inflamed, things will be sore. You may have a lot of mucus. You may have a blocked nose, runny nose. You may worry that if you've got a runny nose and a sore throat, that you shouldn't be singing. So firstly, if your speaking voice is affected, as in you are husky or croaky, or your speaking voice sounds different, and someone else will tell you whether your speaking voice sounds different. If that is the case, then you shouldn't be singing. You should be resting. If your speaking voice sounds okay and your singing voice still works, then there's no reason why you shouldn't sing. If you've got a sore throat, then what you're feeling is the throat at the back here. You're not feeling this bit in your larynx. You can't feel that bit in your larynx. You don't have sensation there for a very good reason, right? It would be very distracting to have sensation from there. But we do have sensation in the throat, the bit that we swallow through. If that feels sore, it can be really uncomfortable, but it doesn't necessarily mean that you shouldn't sing. And the same with having a really blocked nose. Yeah, if you've got an awful lot of mucus in your nose, it doesn't necessarily mean that you shouldn't sing. Yeah, it's just a nuisance. That mucus is actually very good for your voice. It's very useful. We need mucus in order to moisten the vocal folds in order to make a sound in the first place. So mucus is not the problem. The problem is if it's thick and sticky. And if it's thick and sticky, then it sits around and gets in the way and it stops the vocal folds vibrating so easily. And what can cause the thick and sticky? Well, one is an infection. All right. So if it's thick and sticky from infection, you need to make sure that you keep hydrated, that you drink enough, and that if you want to moisten that mucus, then you can do steam inhalation. Steam inhalations are a good thing for the voice. The best way is the old-fashioned way of just boiling a kettle, filling a bowl with hot water, putting a towel over your head, and just staying there for at least 5 minutes. It's boiling water, so don't be an idiot. Yeah, don't tip it in your lap. Don't stick your nose in it, obviously. But it is the best way of steaming. Don't put anything in it. Don't put any oils in it or anything like that. Those are more likely to irritate the tissues than anything else. Yeah, it's the steam that's doing the good thing. You can use a nebulizer if you like. Then you don't have the problem of dealing with hot water. But sometimes the warmth itself can be soothing. So, there's pros and cons. But steam is a good thing. It's a good thing if your voice is tired. It's a good thing if you've got a blocked nose. It's a good thing, first thing in the morning to get things going. It's a good thing last thing at night to calm things down. Steam is great. You can't sing immediately after steaming because everything's a bit hot. But again, that's sort of common sense, I hope. So keep your mucus warm, keep it moist, keep it flowing. What else can make your mucus thick and sticky? Well, dehydration. If you've not drunk enough fluid, that can lead to one of the first things that you'll notice actually is that things get a bit claggy around here. Okay, so keep drinking. Don't poke yourself in the eye with a straw. Another thing that can affect your mucus is your hormones. And female hormones, in particular estrogen levels, can have a significant impact on the vocal folds. The epithelium of the vocal folds has estrogen receptors on it. And the vocal folds will be responding to estrogen levels in your body in the same way that your cervix does. And at certain times of the month, so just before your menstrual cycle and in the first day or two, the mucus will be thicker. And you may find that you've got slight inflammation as well. So on those days, your voice might feel less responsive. It might feel sluggish. It might feel that you can't sing the high notes as well. It might feel like it's not as predictable. And that is purely because of the hormone levels in your body. So on those days, you have to just be nice to yourself and a bit more forgiving about things that might not be going according to plan. And of course, hormone levels will change in pregnancy. So in pregnancy, generally speaking, most women find their voices work very well. But there are other problems. There are problems with fatigue. There are problems with reflux, indigestion. And then in the later stages, there are problems, of course, with breathing. When you've got a body full of baby, there's less room for the air to go in and out. Post-pregnancy, hormones go all over the place. That can have an impact. And then when you reach menopause, that will also have an impact on your voice. So all of these considerations, that you know that it may affect your voice. It doesn't have to. Not everybody does. Not everybody has these disastrous times. Some people sail through and don't even notice. But just be ready and understand that other people will be going through that. So we're still on mucus. Why you might have thick and sticky mucus. So when you have a cold, again, just be nice, steam, look after yourself. What else will help your voice, of course, is overall levels of fitness. Some more research from the States, from Kitty Verdolini, who's a brilliant speech and language therapist and research scientist there. One of her projects was measuring the inflammatory responses on the vocal folds, so how inflamed they get and how quickly that inflammation goes down. And she found that in singers who are physically fit, their voices recover more quickly. So being physically fit basically means, the ones who can run further and the ones who exercise frequently and don't get so out of breath. It's measured by measuring either your VO2 max or your lactate thresholds, or all those sort of measures. But it really is just how much exercise you can do. And if you're physically fit, your voice will recover more quickly. That ties in also with anxiety levels, because I said this is a subject that just pervades the whole thing of vocal health, is your mental state. If you are a little bit worried about something over a prolonged period of time, what happens in your body is your body is heading a little bit towards a sympathetic response of the autonomic nervous system. That's your fight and flight mechanism. All right. Now, full-blown fight and flight is absolute panic, all out. Yeah. We don't often do that, but a lower level of anxiety will mean that your cortisol levels are up a little bit all the time. It means that you are in a state of holding. Yep, your body is just sort of getting ready to react, and everything is holding. The other things, of course, that happen when you're in this low-level, rather long-term anxiety, is that your immune system becomes compromised, your digestion is not working as well. All of those sort of everyday bodily functions will be affected. Now, the holding, what does that do to the voice? Well, any holding in the body will mean that the little delicate muscles around the larynx are also going to be holding. They don't need to be holding very much in order to have an impact over a period of time. So how can we release those muscles? We can't get in there and do anything to them. We can't feel them. We can't do that. What we can do is release the muscles around them. So when I'm doing rehabilitation work with singers, one of the first things I do is to get them to sing gently, through pitch glides and things like that, whilst doing movements. Yeah. And if you can sing whilst doing this, and if you can sing whilst doing this, and whilst doing this, then you're less likely to be holding onto those muscles, because they're having to move. It's simple, really. And then you can extend that so you can do circles with the end of your nose. And then you can do more complex things like write your name with the end of your nose. You can write your name with the back of your head or the top of your head. You can write your name with your tailbone. And that wiggle there of going through your tailbone. All right, head you down. There we go. Wiggly hips. That will mean that you're less likely to be gripping onto your breathing mechanism. All right, so you know when you're anxious, when you're worried, yep, you hold in your shoulders, ready to whatever, lash out. You hold here in your midriff, because that's your core that will help to stabilize you if you have to run fast. Okay, so there'll be a little bit of holding there. And that, of course, won't help your breathing for singing. So moving the hips, moving the shoulders, moving the head. The other thing about doing the silly games like writing your name with the end of your nose and writing your name with your tailbone is the distraction. So if you can distract your student or yourself by concentrating really hard on writing your name with the end of your nose, you're less likely to be worrying and holding on, listening, analysing, messing with the sound, getting in the way of yourself. Okay. So keeping everything moving. Movement is medicine for the voice. What else can we talk about? I don't see any questions have come in yet, so that's fine. I will just keep talking. Let's talk about eating and drinking. Now, I know that you've already had Duncan Rock talking to you about nutrition. I'm going to talk to you about swallowing. What happens when you swallow? Okay, when you swallow, your larynx lifts and tips forward. You can feel it. You put your fingers on here and swallow. You feel it move up. Okay, it moves up. The epiglottis, which is a little cartilage flap at the front of the larynx, will pull back over the top. All right, it's pressed down by the back of the tongue. So the whole system closes off. And what you are swallowing goes back behind the larynx and down into your stomach. Useful. It's a pretty good mechanism. It's complicated, but we practice it before we're born. We practice it when we're in utero. We learn to swallow, we practice it, we come out able to swallow. Very handy. So 2 things to consider with that. The first is in the larynx itself. In the larynx itself, that lifting and squeezing, pressing everything together, will actually spread whatever mucus is in there over the vocal folds. So you've got mucus coming up from your lungs, you've got mucus coming back from your nose. It's a constant flow, right? You're not aware of it, but you've constantly got this flow going through the system. Every time you swallow, you gather up the mucus that's coming up from your lungs, you squeeze it over the vocal folds, and anything that's left over gets shoved back into your throat and down into your stomach. All the time. You swallow about 3,000 times a day. All right, so that's quite a lot of mucus that is coming up from your lungs and going back down into your stomach. You don't need to worry about it. It's perfectly natural. It's what happens. But that mucus getting squished over the vocal folds is really useful for moistening them. So that mucus going over the surface is like moisturizer, rubbing it over the vocal folds. So when you swallow, you are lubricating your vocal folds, but you're lubricating them with the mucus from your own body. The thing that you are swallowing in this case water, but it could be food, it could be that you're taking a pastil or that you've got medicine or whatever. Whatever you're swallowing is going straight into your stomach. It's not going anywhere near your vocal folds. If it did, it would make you cough. And we've all done that. Yeah, you get it wrong, you inhale a bit and you cough a lot. So that means that if you have some kind of favorite honey and lemon tea or your favorite throat pastils or whatever that might be, and you think that's really soothing, I like that. The soothing is just a nice feeling in your throat. It's not actually doing anything for your larynx. It's not going anywhere near your larynx. You don't want it to go anywhere near your larynx because it'll make you cough. The soothing sensation is just this nice feeling, which is great. Yep, we like nice feelings. We know that the placebo is really, really powerful. Yeah, it's a really important part of our healing and how we get better. But there's not much point in spending loads of money on a placebo. So, cheap honey and lemon, honey and ginger tea, yeah, is just as good. If it tastes nice, it's fine. So is there anything that you might be taking that is harmful? Quite possibly. One potentially harmful thing is menthol. And we think of menthol as being, very good for the voice. It clears your tubes. It's got anti-inflammatory properties. It could be a good thing. But menthol in too high a quantity is actually quite irritating for the membranes. Have you ever used that mint shower gel? Yep, and the mint shower gel smells great. You put it onto a sensitive part of your body and it stings and it hurts. Okay, because it's an irritant. So menthol or mint in small quantities, the kind of quantity that you have in your toothpaste, isn't going to hurt your voice because you're not gargling with toothpaste. Yeah, there's just tiny amounts that go down into your throat. And the kind of amounts that are in menthol sweets and lozenges may well be harmful. And the kind of menthol amounts that are in the oils that you might want to put in your steam inhalation, yeah, they are potentially harmful too. So just bear that in mind, all right? No menthol if possible. No anesthetics. Yeah, if you are taking something like a Strepsil, which has got anesthetic in it, right, that will help you if you've got a sore throat. But if you've got a sore throat, you probably don't want to be singing because it's uncomfortable. If it's not so bad and you're happy singing and you know that your speaking voice is unaffected, well, then you don't need to anesthetize it. Because the anesthetic is just going to throw things a bit, isn't it? It's going to mean that your sensory feedback is altered. So probably not worth doing. What else about swallowing and eating and drinking? Well, we know that eating late at night is not a good idea because you may be more prone to reflux. We know that eating dairy is not a problem. The fact that dairy might cause mucus is a myth. It's just purely a sensation of clagginess. It's not a problem. What else should you avoid before singing or before performing? Alcohol. Because alcohol will impair your motor control. It means that you're not able to do that fine control over your voice that you'd like to be able to do when you're performing. And of course, it impairs your cognitive control. You're not concentrating so well. So don't drink before a performance. What else might you be eating or drinking? Caffeine. Caffeine is, again, it's a personal thing. Yeah, there's no evidence to show that it's problematic for your voice. Everybody has their own personal responses to different foods, and you know what you can and can't have. But the important thing is that there is nothing to say that other people shouldn't have it. So if you don't like the feeling of drinking milk and singing, you can avoid it, but you don't need to tell everyone else that they shouldn't do it. So we've got a couple of questions coming in now. Peppermint oil supplements that aid digestion. Firstly, they may not aid digestion. Yeah, it may be just marketing. If you're just swallowing it, it's not going to go onto your larynx, is it? The problem is with the lozenges that sit around, so that there's a lot of, you're swallowing tiny amounts and it's coating the back of your throat, and it's more likely to be hanging around near the top of your larynx, and the vapors are going to be getting onto your larynx. Yeah, that's what we want to avoid. Yeah, just dumping it in your stomach, it's going somewhere else. Another question is whether you should drink cold water or warm water. We want the larynx to be warm because then the muscles will work more efficiently. So drinking warm water can help for that reason. But drinking cold water can help our vagal responses. So that helps us cope with stress. I know it sounds daft, drinking cold water can help you with stress, but it can. It can help if you are overheated. So it's a personal preference, but there isn't a rule. There isn't a rule. You can have iced water, you can have warm water, whatever you like, but make sure you drink enough. Don't get obsessed with drinking water so that you're drinking so much you're constantly going to the loo, because that's just not doing you any useful favors. But just keeping enough hydration is very useful. One thing that I have to say is going to be really bad for your voice is smoking. Smoking is a no for anybody who wants to sing. It's a no for anybody who wants to live a long and healthy life. All right, smoking will kill you. But apart from that, in the meantime, it won't do your voice any favors. The tar burns very hot. It deposits hot tar straight onto your larynx. You get inflammation, you get long-term inflammation, which can lead to all sorts of horrible things on your larynx. I mean, apart from cancer, which is the obvious one. The long-term inflammation can affect the actual formation of your vocal folds so that they get thicker and harder and stiffer. If you listen to the speaking voice of especially women who've smoked for a long time, their speaking voice can sound very low, right? And that's because their vocal folds have just become stiff and hard. Yeah. So smoking, no. And smoking cannabis is even worse than smoking tobacco because it burns hotter. Vaping, we're getting the research through about vaping now, and it looks like vaping is probably as harmful as smoking. So try and avoid them. I know it's, I can get a bit preachy about this, and it's difficult. Yeah, if you're a smoker, it's very difficult just to stop. But see if you can work with reducing. See if you can go and talk to somebody about it. See how you can just go somewhere along the way to helping yourself out, really. What else might be useful to know about? Inhalers. If you have an asthma inhaler, it's very important that you use your inhaler properly. Make sure that your prescription is up to date. Make sure that you have seen a specialist recently, an asthma nurse or your GP, to make sure that you are on the dose that you need. Make sure that you know how to take it effectively. Make sure you gargle after you've taken it. Wait 1 minute between puffs, all those things. If you can use a spacer, that is good. Now, a spacer is a big plastic tube that you put the inhaler in one end, and then you breathe through this big spacer. And what that does is it means that the particles that you're inhaling are really swirling around in the air before they go down into your lungs. So they're more likely to go straight down into your lungs rather than just coating the back of your throat and sitting on your vocal folds. We want that stuff to get into your lungs. We don't want it to sit in your throat. So a spacer is a good thing. If you are taking decongestants can be helpful. They're vasoconstrictors, so they mean that the tiny membranes, blood vessels in the membranes of your nose, will shrink slightly. So it means that you get more space in your nose, really. More stuff can move. Very good for a day or two, but don't take them for any longer than 3 days, because after that, your body starts to adjust. And then when you come off the decongestant, you're worse than you were before you started. So just for a few days. There's a lot of medications which are incredibly helpful and very useful. We're very lucky to have these things available to us. But we need to use them wisely and know when actually something like a few good nights sleep will help. So my sort of safe alternative medications, my safe treatments that I always recommend for singers are steam, sleep. Yep, sleep will just help so many things. If you have problems sleeping, there are all sorts of things you can do about that. I mean, there are many ways that you can help your sleep patterns. But don't sort of just lie in bed awake for hours. Yeah, the advice is if you're lying awake for more than half an hour, get up, do something, and then go back to bed. So get up, read for a bit, get up, make yourself a cup of tea, get up, walk around the house. Remind your body that awake is awake, and then when you go back to bed, bed is for sleeping. And you're more likely to get back to sleep again. So steam, sleep, voice rest in lots of mini breaks. Generally voice rest. If you feel your voice getting tired, then you just need to think about when you should shut up. And that might be when you've done a whole load of voice use, you've just done a lot of speaking or a lot of singing. Don't then go and get stuck in a conversation with somebody. Just know when to save your battery. I always say this when I'm talking to kids about overusing their voice. I say, remember your mobile phone battery? If you've got a mobile phone with a flaky battery, and a lot of kids do because they have hand-me-downs from their parents, got a mobile phone with a flaky battery, what do you do to preserve the battery? You turn the phone off. You don't use it. You turn it off. And you pace it. You know you've got 10% of battery. You can use a little bit here, but you need to save a bit. Do the same with your voice. Pace it like a battery. Exercise, all over exercise. So, I mean, we have vocal exercise, but all over exercise for the body. Very, very important. Very important for healing. As I said, a fit body will heal quicker. Very important for mental health. Yeah, and if you've exercised and sort of sorted your head out a little bit, then you're less likely to be in those holding patterns. Your voice will thank you for that. And exercise, of course, will encourage you to use your whole body. So when you come to sing, you will be using your whole body more efficiently. So many reasons for staying fit. Change of scene. All right, this is another thing for our mental health, especially if you are stuck indoors a lot of the time, stuck behind a computer. We used to go out, we'd go to work, we'd be traveling, we'd be out and about. We're doing that far less now. So make sure that if you have a break, go into another room, go and stand on your doorstep, look at something different. And if you can get out and go for a walk and get a different view on life, that's a good thing. And getting a different view on life, think about ways that you can reduce your anxiety, maybe try some mindfulness, maybe just knowing what activities will help to make you feel better. Be nice to yourself. And you'll help your body, you'll help your mind, and you'll help your voice, because they are all related. And if you've got a healthy body and a healthy mind, you are more likely to have a healthy voice.